All right, so this is going to be vasculature to the brain. So arteries to the brain, letter D on your outline under Roman numeral 2. All right, so like I said earlier, there are 4 blood vessels that bring blood to the brain. 2 are coming from the posterior side running along the spinal cord. Those are your vertebral arteries. And then 2 of them are coming from the anterior region, and those are going to be your internal carotids, right? The internal carotid is cut here. And here's another one. All right, so that is going to be the first thing we want to notice. The outline begins with your vertebral arteries, so let's start there. So they're going to go through the transverse foramina of your cervical vertebrae, enter the skull through the foramen magnum. Then, so you can see that the 2 vertebrals coming together, they're going to form, right, they're going to merge and form the basilar artery. So the basilar artery is going to be on this structure here. You should recognize this is your pons. And so the basilar artery is going to serve your pons as well as serve your cerebellum. And then you can see that the when you hit the end here of your basilar artery, it's going to split. And these 2 big blood vessels are going to circle back, and they're going to be called the posterior cerebral arteries. So the cerebrum, right, those are the lobes of your brain, and the posterior lobe is your occipital lobe. So your posterior cerebral arteries are going to go all the way back, and they're going to serve your occipital lobes, right? So remember, your brain have 2 halves with 2 occipital lobes. All right, so we have posterior cerebral artery. You can see that we also have some inferior and medial of our temporal lobe served from this artery. Now, I want you guys to look at this little structure coming forward. Appreciate that the blood vessel network here is making a circle. There is a loop or a circle running around this midbrain portion, right? There's the your mammillary bodies, not midbrain, but sort of like your diencephalon region. So there are your mammillary bodies. There's your pituitary gland, right? The optic chiasm is right there, your optic tracts. So this circle of blood vessels is called the cerebral arterial circle, or also called the Circle of Willis. I kind of like Circle of Willis, but it's also known as cerebral arterial circle. So I mentioned that first. It's number 3 in your outline, Circle of Willis. And it's basically so that the posterior blood supply can be linked with your anterior blood supply, and the left and right halves of your brain is also linked. So we're sort of creating a circle that we can have blood sort of from any direction go to different places of your brain. Okay, so let's follow. And so basically in number 3, where it says Circle of Willis, you want to know the blood vessels that are in this circle, right? So we have the posterior cerebral. So right here, we have a little chunk of our posterior cerebral. We have the posterior communicating. So these branches that come up from that posterior cerebral, they're going to communicate with, right? They're called posterior communicating, communicate with the anterior blood vessel coming in. So we have posterior cerebral, posterior communicating, anterior cerebral, anterior communicating. So the anterior cerebral is going to be this tiny little chunk right here. That's going to be right between your 2 anterior cerebrals. So your anterior cerebral is going to come up forward and serve the anterior lobe of your brain or the frontal lobe of your brain. But there's 2 of those anterior cerebrals, and the communicating is just a tiny little chunk that helps to bind or link those 2 anterior cerebrals. Okay, and this is also your anterior cerebral. So this so you go posterior cerebral, anterior cerebral. This is still your anterior cerebral coming up, and then between them is your anterior communicating. All right, so all 4 of these blood vessels are part of your Circle of Willis. But let's follow the number 2, the middle and anterior brain get its blood from the internal carotids. So we find our internal carotid that has been cut here. All right, so that's, imagine the blood vessel coming at you if you're looking at the screen, right? That's going to be the neck. It's going to come up from here. The blood will then come wide. So you see how this branch comes towards the lateral sides of your brain. So that's going to be your middle cerebral artery, okay? Middle cerebral here. It's named here, I don't know why. And this leader line is off. This should all be middle cerebral here. And then your anterior cerebral, right, is going to be, we looked at that, so it's going to be this little tiny guy coming forward, and then forward, forward, forward along the frontal lobe. So the middle cerebral artery is going to serve the middle portions of your brain, so the temporal and parietal lobes, whereas the anterior cerebral artery will help serve the frontal lobe and then the anterior portion of the parietal lobe. All right. So that is the vasculature of your brain. So all the other extra blood vessels that are listed here, you are not responsible for, okay? I'm not going to ask you to point out these ones that are not listed in your outline. Okay, and this is a nice rendering of the blood network coming into the brain. All right, so a person who has a blockage in their middle cerebral artery may have problems with what? So you can pause it and think about it, but the answer is the middle cerebral is going to serve that middle portion of your brain, largely the temporal lobe and some of the parietal lobe, right? So what is going to be most affected? You should come out with processing sound, because the temporal lobe is responsible for sound. It's the auditory cortex. All right, moving down the leg. So we are starting up here, right? So we mentioned again in the outline, there's an internal iliac and external iliac. So again, remember that split. Common iliac is that initial split. Common means that we're looking for another split. Internal iliac is going to serve our pelvic organs. And then our external iliac will continue down the leg. When it passes by your inguinal ligament, we're going to call that femoral artery, okay? So the femoral artery is going to run down the anterior thigh. It's going to serve all the muscles in the skin there. So your quadriceps muscles will get their blood supply from the femoral artery. They're going to pass through the adductor magnus. So that's a muscle. Remember, that's an adductor muscle. And when it passes through that, it's going to go posterior. So it's going to start off in the front, go through one of our adductors, and then now we can see it disappearing behind the knee. When it's behind the knee, it's called the popliteal artery, okay? Then from behind the knee, if you look at your outline, the popliteal is going to split. It's going to split to an anterior tibial and then a posterior tibial, okay? So what I want you guys to notice in this picture is the shaded out color, right? That's behind the bone, that stays behind the bone, right? It's behind the tibia. That's our posterior tibial artery. And then if you look carefully, the little space between the fibula and the tibia, we can see a blood vessel emerging from between those two bones. That's going to be our anterior tibial. So that popliteal will pop forward between our two leg bones, become the anterior tibial, follow down the front of our leg. As it hits our ankle, at the very front of our ankle here, anterior side of the ankle, it changes name to dorsalis pedis, okay? So right here, it's called dorsalis pedis. Dorsalis pedis will do a loop on the top of your foot, and the loop is called the dorsal arch. And then off that dorsal arch, we're going to have our digital arteries going to our toes. All right, so that's the front. On the back, the posterior side, the posterior tibial it just doesn't say change name. It just says posterior tibial all the way down. It does a plantar arch. So the plantar portion of our foot is on the bottom of our foot. So think about like the word plantar warts, if people get warts on the bottom of their foot. So the dorsal arch is the top of the foot. The plantar arch is the bottom of the foot. They both do those things, okay? Now I have little, another side off the tibial. I lied, I forgot about this. Fibular. This is a better image of this. So let's look for fibular. There's fibular, right? So our posterior tibial, the one that stays behind, right, that goes down the tibia, you can see there's an off branch of the posterior side, and that's going to run down the fibula, and so that's called fibular. Okay, and the fibula is going to serve that fibular side of our leg. Okay, let's just take a look at our close-ups here. So this is our close-up. Again, all of the blood vessels listed here, just know the ones that are in the outline. So you can just ignore all the other ones that are listed here. Don't worry about them. So here's your femoral artery. It does split to go deep, but don't worry about that. Just follow the femoral artery down, right? And we have that nice transition here, external iliac to femoral, because we pass by the inguinal ligament. This one is, we went over this. This is just a nicer picture of those arteries. This is the image from the back of your leg, right? So this is a posterior image. So we can see that here's our femoral. It comes behind the knee. So this is a vantage viewpoint from behind the knee. And then here we can see that split. So here is all posterior tibial, and then here, right, that's that split to fibular. So it's going to split off. So the fibular artery is a branch off of a posterior artery. And then the anterior tibial, you can see that split right here. So right behind the knee, after your knee, you can have a split. So that anterior tibial is going to come forward between the bones. The posterior tibial just stays on the posterior tibia. So I wanted to just show you this picture because of here, the site for palpation for dorsalis pedis artery. So this is actually, this artery has a clinical significance to it because if you're under general anesthesia, you know, the medications for putting you out can be dangerous because it can kill you, right, if it's too much. And so they want to make sure that you have enough blood pressure, your heart's pumping hard enough so that your extremities all the way down to your toes, it's still getting blood, right, that your circulation is working. And so we'll actually feel for a pulse down here to make sure that your blood pressure, your blood is getting around your body and your blood pressure is at an adequate pressure. All right. Okay, so that is it. I'm going to pause here. We'll talk about the veins.